Hello, today we're here to talk about prediabetes. So what is prediabetes? The term prediabetes, or also known as non-diabetic hyperglycemia, means that your blood sugar is higher than the usual, but not so high that we can call it diabetes or be diagnosed as diabetes. For this, it is also known as borderline diabetes. You may not develop any symptoms at this stage, but it does mean that you are at higher risk of developing type 2 diabetes. This is usually determined by blood tests, which can either be fasting or non-fasting, and be done by a healthcare professional to help you understand your risk of developing type 2 diabetes. Understanding what this means, the consequences of uncontrolled prediabetes and how to prevent any further damage in the long term is really important to allow you to gain full control of your health. So having diabetes can actually affect not only the small vessels but also the large blood vessels running through the body. Things like kidney damage, gum disease, sexual dysfunction, weight gain are all part of this. The best way to manage prediabetes is through lifestyle changes. Rarely, some people will also be prescribed medication called metformin, but this is less effective than increasing your physical activity and changing your diet. Not everyone with prediabetes will develop type 2 diabetes if controlled in the right way. Some people will remain pre-diabetic all their life, and some will return to normal blood sugars after lifestyle changes. However, even with prediabetes, there is a small increased risk of complications such as heart disease. Even if you have a strong family history or have diabetes running through the family, you may be able to reverse or slow down prediabetes. You can do this through stop smoking, drinking alcohol in moderation with a maximum 14 units a week, and keeping your weight in the healthy range. For minority ethnic groups, your target BMI should be between 18 to 24.9, which is lower than the target for white British people. Ideally, you should aim for regular exercise spread out over the week. You should take exercise in blocks of at least 10 minutes each time, with small changes that can help you reach a target of 2.5 hours a week, according to guidelines. You can take the stairs instead of the lift, for example, or try walking short distances instead of driving, or you can join an exercise class with your family and friends. Around 10% of people with prediabetes will develop type 2 diabetes every year, compared to less than 1% of people with normal blood glucose levels. Your individual risk can be much higher as well, depending on your demographics and ethnicity. However, to get this checked, you should definitely get in touch with a local GP. There is a free national diabetes prevention programme that is available that we can refer you to as well, and you can attend with a partner or family member to help you learn more about your risk and how you can improve your health. Dietary and lifestyle changes can be helpful in reducing your risk of developing prediabetes. If you are overweight or obese, studies have shown by losing 5 to 10% of your body weight can actually have a great impact and will help to improve your overall health. If you're able to lose this weight, around your waist especially, this is really key. This will help to reduce the stubborn fat around your organs, which will in the long term really help to improve your health. Here are some top tips to help you manage your pre-diabetes and also help lose some weight. First of all, eating regular meals throughout the day will help to provide that background sugar release, as well as eating smaller portion sizes will help to cut out any snacking during the day. Having regular fluid intake, mainly water, 6 to 8 glasses a day is recommended through national guidance. This will also quench your thirst and prevent you from having sugary beverages such as caffeinated drinks like coffee and tea with the extra sugar, fizzy drinks, or any other alcoholic beverages. Alcohol, limit it in moderation. The maximum weekly guidance is 14 units a week. Ideally, quit smoking because that will help only to increase weight. And lastly, ensuring that we're having lots of nutritious foods, unsalted nuts, unsweetened yogurt, low-fat butter and spreads, as well as making sure we're having 5 portions of fruit and veg a day. We really hope today that you have all the information provided to help tackle prediabetes and help kickstart that journey. Further information can be provided on the NHS website.